that means.
All right.
In the meantime.
In the between time. Now, the government has been criticized for failing to reduce burnout among the nation's nurses. I'm reading here, folks. That's not me criticizing them. Who have been doubling and tripling up on duties at public hospitals and health centers amid increased workload since the onset of COVID-19. They have also had to defer vacation leave, which is what I could not understand when I'm hearing that the doctors don't have a job. Because if we need all hands on deck, especially now, why the doctors, I think the president said there were 102 doctors out of work. Is it
that we need more nurses than doctors? I doubt that.
I mean,
you're going to need many nurses on the ward to deal with the patients, but still.
Yeah, the president said the 5,000 strong registered nursing staff have been forced into brutal shifts, some even reporting for duty 7 days a week. She says, and I quote, the same individuals who run the clinics have to also be assisting their colleagues at the airports. They leave at 2 p.m., 4 p.m. for the airports, come off in the nights and go back to the health centers. They are burnt out. Whew. It's not good news. It's not good for them. It's not good for who they're treating either. Wow. Now, Dr. Tufton said the ministry was also looking to incorporate more doctors into the system who recently graduated from medical school or are currently out of work. Well, maybe the 102
will get their jobs.
Will get something good.
We express gratitude for the nurses for their efforts during the crisis and said arrangements were being finalized to change the status of roughly 2,000 nurses from contract workers to staffers. Also pledged to hire more nurses as well.
Listen, man, them doing I can't use the word that I really want to use, but they are doing such a wonderful job. I stopped to allow couple nurses to go across the road, and I just look at them and I just go say, you know, I was saying, you know, why? Literally risking their lives to save us. Fantastic.
And the nurses, president was saying that they don't have, she said you find out we don't even have adequate equipment to work, and sometimes nurses have to purchase their own.
Whew.